A startling revelation has emerged in the realm of colorectal health. An increasing number of young adults are being diagnosed with colon cancer, and the reasons behind this trend are as mysterious as they are concerning. But here's where it gets controversial. While more cases are being caught early, thanks to a shift in screening guidelines, the overall rise among younger adults remains unexplained. And this is the part most people miss. The potential culprits could be lurking in our daily lives, from microplastics to ultra-processed foods, and the implications are profound. In 2018, the American Cancer Society, ACS, made a significant update to its guidelines for colon and rectal cancer screening, recommending that adults at average risk begin screening at age 45, a departure from the previous recommendation of 50. This change was echoed by the U.S. Preventive Services Task Force in 2021, further emphasizing the need for earlier detection. The shift in guidelines has been associated with a recent increase in early-stage colorectal cancer diagnoses, but it doesn't fully explain the broader trend among younger adults, which began in the mid-1990s and includes late-stage cancers as well. Elizabeth Schaefer, an associate scientist of surveillance and health equity science at the ACS, notes that the drivers of this rising incidence are still unknown. But ongoing research is exploring a wide range of factors, from microplastics to ultra-processed foods and other gut exposures introduced in the latter half of the 20th century. Dr. Joseph Rinaldi, a gastroenterologist at Montefiore Einstein Comprehensive Cancer Center, adds that while lowering the screening age has likely facilitated earlier detection, there is still much work to be done to identify the underlying factors driving the overall rise in colorectal cancer among younger ages. Recent research published in the medical journal JAMA by the ACS found that the percentage of U.S. adults aged 45 to 49 who are up to date on colorectal cancer screening has climbed from 20.8% in 2019 and 19.7% in 2021 to 33.7% in 2023. This increase in screening has translated into early diagnosis, which means less intense treatment and potentially saved lives. However, the prevalence of early-stage colorectal cancer diagnoses among adults 45 to 49 has also seen a significant rise, from 9.4 cases per 100,000 people in 2019 to 11.7 per 100,000 in 2021, and then to 17.5 per 100,000 in 2022, representing a 50% relative increase between 2021 and 2022. As the incidence of colon and rectal cancers continues to rise among younger adults, public health experts urge them to be vigilant about warning signs and to get screened when eligible. More than half of those diagnosed with colorectal cancer before 50 are not eligible for screening due to not reaching the recommended age, and many who are eligible have not been screened. Jessica Starr, an associate scientist of cancer risk factors and screening surveillance research at the ACS, advises that everyone, regardless of screening recommendations, should watch for signs and symptoms of colorectal cancer and consult a doctor if any are noticed. The most common symptom is rectal bleeding, experienced by 41% of patients under 50, compared to 26% of patients over 50. Other symptoms include abdominal cramping or pain, persistent changes in bowel habits or stool shape, decreased appetite, and weight loss. Young people in particular may be hesitant to discuss these symptoms, but doing so could be life-saving. If concerns are not being addressed, seeking a second opinion is crucial, as there are numerous instances of young people being misdiagnosed and finding out months or years later that they have cancer. Kelly Spill, a 33-year-old mother, experienced symptoms of colorectal cancer after the birth of her first child. Despite her doctors attributing her symptoms to postpartum effects and internal hemorrhoids, she persisted in seeking answers. After showing photos of the blood in her stool to her primary care physician, she was diagnosed with stage 3 rectal cancer at age 28 in 2020. Spill's story underscores the importance of self-advocacy in healthcare. She was treated with an immunotherapy drug and is now a healthy mother of 3, cancer-free. Screening is crucial in reducing the risk of colorectal cancer, as almost all cases begin as precancerous polyps in the colon or rectum. Current screening options for those at average risk include annual or triennial stool-based fecal tests, a traditional colonoscopy every 10 years, a virtual colonoscopy every 5 years, or a sigmoidoscopy procedure every 5 years. A study published in JAMA found that when people newly eligible for screening were automatically mailed a fecal test kit, they were more likely to complete screening than those who had to actively choose between a colonoscopy, a fecal test, or deferring screening altogether. Despite recent increases in screening, it's estimated that more than 1 in 3 adults aged 45 and older are not getting screened as recommended. In addition to screening, there are other steps individuals can take to prevent colorectal cancer, such as maintaining a healthy body weight, being physically active, avoiding excessive alcohol consumption, and eating a diet low in red and processed meat and high in whole grains, fruits, and vegetables. More than half of all colorectal cancers in the U.S. are attributable to these modifiable risk factors. Maintaining a physically active lifestyle and a healthy weight is crucial, as obesity has been linked to early onset disease. Avoiding tobacco, refined grains, and sugary beverages, and focusing on a fiber-rich, plant-based diet that limits red and processed meats is also thought to be protective of colon health. The mystery surrounding the rise in colorectal cancer among younger adults is a call to action for further research and public awareness. As we continue to unravel the complexities of this disease, it's essential to prioritize early detection and prevention strategies. What are your thoughts on the potential causes of this trend, and how can we better educate and empower young adults to take control of their colorectal health? Share your insights in the comments below.